that, to make a difference and to, speak for patients who, don't want to speak. A lot of patients tell me like, "Oh, I haven't told my family and friends about it. I don't want to tell my family and friends." And, for whatever reason, that's fine. That's their own, personal health history. But there's those of us that do need to speak on their behalf, and I feel like I'm called to do that.
Welcome to season 3 of the Ophthalmology Experience powered by Boost Patients. Today, we're joined by Hillary Golden. Hillary is a founder of Glaucoma Coach, a keynote speaker, consultant, and a patient advocate. After more than 25 years in medical sales and surgical training, she was diagnosed with severe glaucoma in 2020, which shifted her perspective from industry insider to patient advocate. Today, she works to help patients and advocate for themselves while strengthening the connection between patients, providers, and the eye care community. Hillary, welcome to the show.
Thank you, Guido. I'm excited to be here.
Yes, and it's really cool to meet you virtually. So nice to meet you virtually.
You too.
This is one of the reasons I'm doing this to meet cool people and learn a lot of great stuff. So thanks, good to meet you. The other thing that I think is very cool for today is that you're coming from both the perspective of the practice and side and the industry side, and also from a patient perspective. So that's also very unique. So I'm really excited to kind of hear how those perspectives help shape your approach. So
Yes.
just so the audience can get a little bit more of an understanding of that perspective, can you share a little bit about your background and kind of what drew you into the world of medical sales and surgical training, and maybe a little bit about yourself?
Sure. So I have been in, as you said, medical sales for about 25 years. I started in pharmaceutical sales and was just interested in finding a way to help people. And it was kind of an outlet that I enjoyed and was interested in. So started in pharmaceutical sales. I moved into dental sales, and then I moved into capital equipment. So I sold CTs, I sold imaging equipment, I sold software. Um, and after that, I moved into surgical training, so training doctors on computer guided surgical navigation. And in 2020, whenever COVID came around and the world was shut down, I had a sty. Went to see an OD who diagnosed me with glaucoma. So it was a shock because I didn't know anything about glaucoma at that time. And I was just going to see about this sty. So, learning that I had glaucoma at that appointment was, it was shocking, and then finding out later on how severe my glaucoma was even more shocking because at the time I was just kind of taking things as I could, little bit by bit, learning more about glaucoma. And after I learned more, I ended up taking a job in glaucoma sales. So I sold glaucoma devices for a couple years and learn more about glaucoma itself and learn about treatments and options for patients. And it really kind of, what I found after learning a lot, and I'm the kind of person that researches everything. So I was reading, multiple studies a day, just ramping up my knowledge really quickly. In addition to selling and then asking doctors lots of questions. So when I would go in to sell to doctors, I'd ask them, "Well, why would you use this? Why would you use something different? Or what are your thoughts on this?" So finding out, what their thoughts were, because getting that perspective, not only helped me, but helped me learn how to talk to patients better, and understanding the why behind everything and the psychology of why you pick something over something else. And so that all helped me to kind of culminate into what I'm doing now, which is being a consultant for industry partners, so companies in eye care, and then speaking at different events, national sales meetings to give that patient perspective. And then I coach patients one on one. So when I coach patients one on one, I have that background of understanding the insurance piece of it, the reimbursement piece of it, why a doctor might suggest one procedure or surgery over another. A lot of patients are confused as to, well, I'm having cataract surgery, but my doctor wants me to have glaucoma surgery at the same time. And just being able to tell them, hey, this is normal. This is the best time to do it because they're already inside your eye for the cataract surgery. So, this is a great time to do a mixed procedure for your eye because they're already in there. They don't have to go in your eye twice. So, learning these things and being able to understand and explain this to patients on a different level where you're a patient explaining them and explaining it to them instead of a doctor explaining it, it makes a huge difference because they just feel different about it. They trust their doctor, but they also trust a patient that understands it. So it's
Right.
kind of I've seen this gap that's in the market with patients and doctors and not being able to kind of put the two together and the patient's not having enough time to ask questions to the doctor. And so I've really tried to fill that gap. Obviously, I'm one person, um, but that's what my mission has been to do is to help patients understand a little bit better.
Yeah, that's really cool. I think from the perspective of a patient, or sorry, that you came from industry and medical device sales and you had a certain background knowledge, and then you learned that you had this condition of glaucoma. And I'm sure it was a little bit, even you knowing and having some understanding of what it is, a little bit of trepidation, just a lot of questions. What is this? How severe is it? What is a doctor going to recommend for me? And that's you who has the experience. And as you mentioned, patients that don't have an understanding, don't have a background, there is a huge gap there.
Yes.
I mean, and so I think you are in an awesome position to help, as much as you can yourself, and then teaching others to fill the gap. Because we always coach all of our even surgical sales teams. Like if you're selling a procedure, like let's say LASIK, if you hadn't had it, well, you should have it because then you fully understand when you talk to a patient exactly what's going on. So whenever somebody comes in with glasses, we're like, no, 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 you got to have LASIK if you're going to talk about it because it gives you a different perspective. And you can tell just from
Yes.
the short introduction that you gave, you have you have a level of passion because you're coming at it from the perspective of a patient. Um, so you mentioned I want to touch a little more on the coaching part. Is that the glaucoma coach that
Yes.
I mentioned earlier? So how does that work? Because like you said, you're one person, but I'm really
Yes.
interested to understand kind of how how it currently works, how do patients get involved? Because I think even at a higher level, how can we take something like that and scale it if we learn what you're doing really well?
Sure. And it's one of those things that it's, individualized, so when I first got diagnosed, I reached out to, the Glaucoma Foundation and did a webinar with them, and, again, with my unique background of having that perspective of being a patient, but then also selling into the industry and also working with doctors, and it's kind of a three-pronged approach where it's, this triangle of the doctor, the patient, and the industry because there's the products that they're using, right? So whether that's a drop, a pharmaceutical, or if they're going to get a MIGS procedure or an SLT or more invasive surgery, it's really like figuring out how to make that tripod stay upright and understanding those three pieces of it. So with the patients, after I did the webinar, patients started reaching out to me and saying, "Can you talk to me?" And this was kind of, just out of the blue. Patients were reaching out to me on LinkedIn and finding my email. And I was like, wait, what's happening? And so, once I started talking to patients and said, oh, sure, I can talk to you for a few minutes. And then I would talk to these patients. And then I realized, like, this is something that, I'm helping these patients. And this is something that I can't not do. It was kind of driving me because I knew I had this unique perspective that I could really help them and brought a level of understanding to them that they just didn't have.
Great.
So, the one-on-one that I'm doing now is, patients reaching out to me and then, usually, some patients I talk to once a month and I just kinda guide them through different questions they have, different challenges. there's the emotional piece of it. So I kind of look at it again in the three parts that I talked about, but then there's three other parts once you get into it. There's the emotional piece, there's the educational piece, and then there's the plan to move forward. So what I find is a lot of patients get stuck in that emotional piece because they don't when you don't understand something enough or you don't have enough conceptualization of it, it's confusing, and so you're in kind of this in between stage of not really understanding enough and not knowing how to move forward. And what I find is if you acknowledge that emotional piece and say like, "I understand you're confused," and other patients feel like you do, and all of a sudden they kinda soften up, and then you can get to the educational piece that's missing, because if you're stuck in that emotional part, the educational part never goes very far. It kind of goes in one ear and out the other. So we
Yeah.
go to that educational piece, and then finally we figure out a plan to move forward. So whatever that plan is, sometimes patients need to get a second opinion. Sometimes patients need to get preservative free drops. Sometimes patients need to get a MIGS procedure. Sometimes patients need SLT. So it's figuring these things out with the patient. I don't give medical advice, but I explain these different things that they've heard from their doctor so that they
Yeah.
better understand it. And when we finish our session for the day, they feel a lot better. They feel a lot lighter. They feel seen and heard, which, there's not enough glaucoma specialists out there. And there's just the ones that are out there are so inundated with patients that they don't have the extra time to sit with the patients and explain these things. So that's where I've come in and helped. And right now I'm not like really scaling myself up too much, but I see that there's a need, and that could be something in the future that I try to do to help patients.
Yeah, that's awesome. And me coming from the side of managing a practice and helping the providers support the patients that they see,
Yep.
something there you said is interesting. If how do you get patients past the emotional phase and then into the educational phase? Because we see that a lot with all conditions that patients don't really have an understanding, and whatever that diagnosis is, they might have an emotional reaction, and we give them information, but then they don't really retain the information
No.
because they're not, I guess, ready emotionally or ready to receive it and learn that. So have you considered, or from the perspective of maybe teaching practices or providers how to better approach getting patients through those phases as a way to kind of help scale yourself? Because you can only, like I say, you can only do it
So
so
much.
many people. Have you ever considered, or do you work with practices to help them get patients through this phase?
Yeah, I've done a little bit of work like that, which has been really fun, and I love to do that.
Okay.
So working with with techs and with the doctors themselves to just give information to patients in a different way, and it's so subtle, the differences that you can make just in your verbiage and how you explain something to patients, and it just changes. Like I said, sometimes I'll talk to someone and it their demeanor changes in a couple of minutes, and all of a sudden they just can listen, because they're not stuck in that emotional state. And you have to look at it from a patient point of view too. Is they're getting this information that can be shocking. When I was diagnosed, I didn't realize the severity of my glaucoma, and then once I understood it more, I realized like, oh my gosh, I've lost 40% of my sight, and my VFI was at, right about 60%. My mean deviation was -12, which is considered severe glaucoma. So the lucky thing for me is my sight loss is by my nose, and so your brain interpolates data and fits all these pieces together. And I used to sell CAT scans. CAT scans interpolate data. They fit pieces together to create a 3D model of the brain and the head, and what I used to sell. And patients, so I understand it in a different way than most patients understand it, because I used to sell in that arena. And so just explaining it in a way that they can understand and figuring out how to it's mostly just being listened to. And a lot of times patients feel like they're being rushed through their appointments. And once you just take a minute and say, I the best question I tell doctors they can ask a patient is, how can I support you today? And what happens when a doctor asks a patient that is I've had patients just break down. I feel like finally you're seeing me. And it's that one question, how can I support you today? That makes so much of a difference because they just feel like they're not being told we're going to do this OCT or this visual field or we're going to do a fundus photo. They feel like, oh my gosh, they because the doctor cares about that information. The patient wants to provide that information and that data to the doctor, but it still doesn't feel like they're seen. And so when you ask, "How can I support you?" all of a sudden, it's like, "Oh my gosh, they care about my eyes, they care about me," and it changes the situation. So that one question can change a lot, and I would love to work with more offices. I've kinda done it as like a beta testing type of thing, I think on a larger scale, it can make a huge difference in patient care.
Quick break brought to you by Boost Patients. If you're listening to this podcast, you're probably a physician, a practice admin, or maybe someone on the marketing team, and you really have a singular goal. You want new patients, more consults, higher surgery volume. And oftentimes, when you want that, you think immediately about marketing, spending more on marketing, investing more in marketing. Maybe, but probably not. We've mystery shopped over 600 practices, and there's one commonality with all of them. They're not very effective and not very good at patient follow-up. So before you invest more money in marketing and more into that investment, you really need to understand how your practice is following up with new patients. So go to boostpatients.com, fill out the contact us form, and let me know that you want us to mystery shop your practice. We'll mystery shop it. We'll document how your practice follows up with your new patient lanes, and we'll share that information with you. Now, back to the show.
How would you answer a provider that says, well, Billy, I agree with you. I think I want to make sure that my patients feel heard, and but I struggle with the balance between I only get 2 or 3 minutes for each patient that I see because I'm having to service a lot of patients, and where do I strike a balance? How do I do that?
I think it's one of those things where you have to kind of manage your patients and get the signs from them, and again, like, I know the doctor side, they're spread ridiculously thin, and I know my glaucoma specialist, at one point said to me, "My favorite thing about being a glaucoma specialist is doing cataract surgery, because cataract surgery makes a difference," right?
Right.
All of a sudden, they couldn't see clearly, and now they can, and, maybe they don't need glasses anymore, and there's this the patients are happy, right? So with glaucoma specialists and glaucoma patients, you're giving not great information to these people. So it can be very hard on the doctors. It takes an emotional toll. And I completely understand that piece of it. And um, my strategy is every day taking a little bit longer with like maybe 1 or 2 patients, to just like help those 2 patients be seen because you can't do it to everybody every day, and just kind of trying to balance that out throughout your patient load, over time, just giving those couple of patients a little extra time, then it does make you run late for the next patient, but then you got a little bit more ground with them, and then the next time they come in, they're maybe not as, don't feel as needy for the
Sure.
doctor because they got a little more attention. So, it's not it's a something very small, but the reality is that's what we're dealing with right now is, some glaucoma specialists are seeing up to 100 patients a day on clinic days, and you just can't, spend 15 minutes with every one of those patients.
Mhm.
And, on my side, I'm teaching patients to become their own advocate. Like it the goal is not for me to just keep holding their hand. The goal is for them to become their own advocate, become their own hero, and learning how to talk to the doctor better. And a lot of these patients are just scared to ask doctors questions, and they're scared to question the doctor, and they're scared to get second opinions. So giving them permission to do that, that lightens their load a lot. And so I teach them, like, just go in with your two top questions. Have two questions for the doctor and get those two questions answered. And then the patients, when they do that, so I think it's not just from the doctor side that can be helpful, it's from the patient side as well, because the patients can help to facilitate that communication a little bit better too. Because the doctor doesn't know what the patient's worried about. They might think they do, but they don't necessarily. That patient might be worried about something totally different than the doctor thinks. Some doctors don't suggest surgery as early as they could, or SLT as early as they could. And that patient might be sitting there thinking, I wish there was something more I could do besides drops. And, the first time my doctor told me, oh, there's this laser we could do, and you might not need drops after you do the laser. And I was like, what? Why didn't you tell me about this a couple months ago? And, so you can't assume that you know what the patient's afraid of or worried about or apprehensive about if you haven't asked them. And so it really does take both sides. So it's not a simple answer, but on the doctor side, those couple extra minutes for a couple patients a day can really make a difference over the long run, because they feel a little bit more seen and a little bit more heard.
Yeah, that's very powerful. And everything we've talked about to this point, it to me it highlights the importance of interventional care.
Yes.
Because I'm curious too from your perspective, because you're connected to the industry, you're likely have more of an understanding of how it works. Um, maybe if you personally would have gotten seen, I guess, or maybe your doctor would have pointed it out sooner of, hey, it looks like we were seeing a few pressure spikes, or we're seeing something on your OCT. Or so in terms of educating patients and educating really providers on how to approach treating glaucoma, specifically interventionally, how important do you think that is in this whole equation?
I think it's huge. So for me, I was going regularly to the doctor, to the ophthalmologist every year, and I have normal tension glaucoma, which is a lot harder to catch. So, um,
Uh,
for there's a lot of different theories on normal tension glaucoma, but a big piece of it is vascular dysregulation. So having vascular dysregulation and it not knowing, I none of the we went back and looked at my records, and like I said, an OD, is the one who diagnosed me, and we went back and looked at my records. There was no indication of any, my pressure was never high. I never had any cup to disc ratio discrepancies that were a red flag. Nothing came up, right? So I'm kind of an anomaly like that, but this is why I'm such a big proponent for just eye exams in general. So, a comprehensive eye exam every year, especially for those, also, we didn't know that I had glaucoma in my family, that it was in a family history. And I took recently a genetic test that showed that I'm on the high end of the chance of getting glaucoma. I mean, obviously, I already have it, but there's also other things that these genetic tests measure. And knowing that information now, I can then talk to my sister and brother and say, hey, you need to go be very diligent about getting your eyes checked, make sure they're doing an OCT on you in a visual field just to get a baseline, right? So if there's any changes, they know that. So for me now, knowing where I am and that I'm at like a severe stage and that I have normal tension and that I am young enough that I don't have cataracts yet, so for me, I'm a little trickier because there's, the cataract piece and the MIGS, and then DMIGS really work well for normal tension glaucoma. There's some new studies that are showing that it does have some promise for normal tension patients, which is exciting to me. But knowing what I know now, if I had, high pressure glaucoma, and my eyes were progressing, it's like it wouldn't even be a question about getting a MIG surgery or, a more interventional surgery or absolutely SLT. And there's new every day there's new surgeries coming out and new therapies coming out. So I go to a lot of the meetings. I was just at the AGS meeting, and there's lots of new neuroprotection, which is an area that I think really needs more focus. And companies are starting to do research there and focus on that. I mean, they've been doing research there. There's also a lot of research on, B3, so nicotinamide and pyruvate, and they're doing studies on that. They're doing studies on different electrical stimulation for glaucoma. So all these things are just, really exciting that we have, not just all these MIG surgeries and invasive surgeries, but now we have people looking into, supplements that could potentially help, electrostimulation that could potentially help, and other therapies, endothelin receptor blockers and things like that. So all these therapies that are coming out are very exciting. And so I think patients are hungry for something else. For years, the only modifiable risk factor in glaucoma has been eye pressure. So all you could do is lower eye pressure. And now we're being given these other options, which are really, really exciting. And so I see it as just opening up a new window for glaucoma that hasn't been there and really offering more than options, but hope.
I love that. That's amazing. Thank you for sharing. And, as you were talking to, I was thinking about just all the opportunity for interventional care. And I know your case is a little unique, harder to pick up, but there are a ton of cases where the doctor is not aware and the patient's not aware until they start having problems.
Yes,
Right. And so how can we better identify these conditions earlier intervention and treatment and detection? I'll have to plug the Business of Interventional Glaucoma session coming up at ASCRS in April, which I'm going to be there and hopefully learn from some of the industry leaders that are leading the way in some of these things. Because a part of it too is, practices have to financially make enough money to keep it going, and so you can't do tests that are too many tests that are not going to get paid for. But really, there should hopefully, if we can make a case for more intervention, for example, better diagnostic scans, maybe covering an OCT for interventional purpose once every X amount of years for patients with family history, if they can detect that, or instead of having, well, okay, well now I see this diagnosis, then
right.
insurance will cover it. I was watching, kind of funny timing. I was watching the news last night, and I saw this story about these MRI scans that these companies are doing now for just prevention purposes. It's not covered by insurance, and it doesn't. I think there's no radiation, or anyway, they put you through these tests, and it just gives you all these markers of potential problems that you might have. So I think that the industry is starting to shift, hopefully, and I think we're going to have to educate insurance companies and CMS and all those that there is a benefit to early intervention, and it's actually going to save money and also be better for patients in the long run. But we on this side have to figure out, like, how do we make that feasible from a financial standpoint, and how do we help patients get better care faster. And so I think hopefully your mission of what you're trying to accomplish and your advocacy on, from a patient standpoint, will help better tell that story so that we can help get patients care faster and hopefully makes healthcare less expensive. Um, and and I think to see somebody like yourself who's personally been through, as a patient, and it seems like you really have a passion for this education. Um, is that what motivated you to do more speaking events, and maybe you can help us lobby uh, help us advocate for more early intervention treatments? Do you think that you're in a unique position that you can help be more of an advocate for this whole process and for patients as a whole?
Absolutely. I've worked with several organizations. I work with the Glaucoma Foundation regularly, and I do their I'm the moderator for the support group. and I work with a group. I work with Bright Focus. I did a PSA with them. I've worked with a group called Patients Rising, which is an advocacy support group and works with a lot of rare disease patients. But I have gone to Capitol Hill with them. I've gone to Capitol Hill with the National Alliance for Eye and Vision Research, and I've spoken at congressional briefings. Um, and I just feel like I'm called to do this, and I just have am driven from it. I can't stop myself from doing it because I feel like there's just such a need, like you talked about. And my mission is really to incorporate have these organizations and meetings, like the AGS and the AO and the ASCRS meeting, incorporate more patients into like panels and information and speaking, because I think it's so important to just kind of have that merged in. We're hearing about these studies and we're hearing about this new information, but there's no patient perspective on it. And so for me, that's really, one of my goals is to get that to be more common, and have patients be a part of it and have patients incorporated, see how it works. I go to these meetings, I go to an arvo, and I talk to a lot of researchers, and I love researchers. What they do is amazing. They're sitting, at least the doctors, they get feedback from patients. The researchers aren't. They're sitting at their bench doing the research. They don't know what it feels like for patients to hear that this exciting new research is being done. And whenever I meet researchers, I just, I they're like I like fawn over them, like I'm fangirling over over a musician or something, because it's like they're doing the hard work. And so it's so important to get the patient voice out there. And I just don't think glaucoma has been seen as this disease that affects the older generation, 70s and up. And I really think it's changing. There's always been younger patients, but there just haven't been as much light shown on those younger patients. But now there's going to be myopia is on the rise, right? People are looking at their cell phones more. It's actually changing the shape of their eye, creating more myopia. And then there's a new study coming out of China, showing that microplastics are actually getting trapped in the TM, in the trabecular meshwork of the eye, which can raise eye pressure. So there's just from pollution in the air. So these types of things are going to create a bigger increase in glaucoma diagnosis. So like you said, these OCTs, visual fields, things that are being done right now, are not being done, in my opinion, more often enough. So I talked to a patient the other day, and she said, my doctor only does a visual field once a year. Is that normal? And I was like, unfortunately it is. And she said, well, could I offer to pay and get an additional one? I was like, yes, you can. you know but for me, I advocate for myself. I want more than one visual field a year. I want at least three, because my glaucoma is so severe. I want to know if anything's changed. And OCTs are the same, but like I said before, if you have that baseline of your OCT or visual field, then you can see if there's any changes. And the patient I talked to the other day, she said, my other eye is there's this black spot that I'm really worried about. I'm like, that's your optic nerve. So these things aren't necessarily explained to patients. And so giving them a better understanding of what the doctors are looking for, what the visual field means, what those spots are on there, and just kind of that overview. I wish every office had a glaucoma advocate in the office to kind of sit down with the patient after they were diagnosed and kind of explain this to them. And so they had a better understanding. But that's not where we are now. But I'm hoping that, to make a difference, and to, speak for patients who, don't want to speak. They don't, a lot of patients tell me, like, oh, I haven't told my family and friends about it. I don't want to tell my family and friends. And, for whatever reason, that's fine. That's their own, personal health history. But there's those of us that do need to speak on their behalf.
Mhm.
And I feel like I'm called to do that.
Yeah, thank you so much for your advocacy. I think it's very much needed, and hopefully efforts like yours and others, we continue to make a difference and try to advocate for patients and advocate for more interventional treatments and more coverage for interventional treatments and shifting of the system because, like you mentioned, asking for more tests, definitely do it. It's hard because it goes up against the ingrained system of how doctors are
Yes.
trained to treat their patients, and that's based off of multitude of things, but definitely worth continuing the conversation. So thank you from the industry for your advocacy. Um, I want to ask you one last question about, if so providers or practices that are thinking about like, how do I get my patients more resources to either be their own advocate or get more education or even bring more resources internal to help do those things for patients? What would be your advice?
My advice is there's so many nonprofit organizations that who I love working with. The Glaucoma Foundation has resources for patients. Prevent Blindness, I work with them as well. They have incredible resources for patients. The Glaucoma Research Foundation has incredible resources for patients, and it's finding what works for you, what you can use to best communicate with patients. And a lot of these organizations, they'll work with you to get you, if you want pamphlets, if you want information, they will work with you to provide that. And so I think that's kind of the first step is just finding out, what works. Another thing is a lot of offices have a tech or somebody who works in the insurance in the office that does like a lot of the prior auths and things like that. And those people usually know like where you can get the best prices for things. So that's a big piece for patients is pricing. So I think that it's important to understand like the use of coupons for medications if you have insurance. If you don't have commercial insurance, if you have Medicaid or Medicare, then it's better uh, to do generic prescriptions instead of brand names because the coupons don't work for Medicare. So there's little tips and tricks like that that it's just important for somebody in the office to kind of own in order to explain that to patients. And you know, I mean, I'm always looking for great resources, but they're really the nonprofits have really provided a lot of information. Bright Focus has information too, so those are really kind of my go-tos for uh, pointing patients in the right direction. They also do webinars. All of the organizations do webinars and try to provide patients with lots of information. And sometimes those webinars are not sometimes, all the time, the webinars are super helpful and have great information. So these organizations have those as well, which is amazing. And just trying to get information to patients that is important and that they want to know more about.
Okay, well, I think that's our time for today. Hillary, thank you so much for joining and sharing your knowledge and sharing your perspective. And thank you. Please continue your being an advocate. I think it's very much needed. So thanks again for joining me.
Thank you, Guido. I appreciate it. Thanks for having me.
Thank you. And also want to take a moment to thank the listeners for joining. If you enjoyed the conversations, please make sure to subscribe and share us with your friends on social media. Another quick shout out to Boost Patients for producing the podcast. Boost helps ophthalmology practices get more new patients without spending a dime on marketing. You can learn more about them at their website, boostpatients.com, or just check out the show notes. Until next time, have a great week.